Many specialists disregard the topic of parasites. Some may argue that the issue only affects individuals residing in underdeveloped countries with poor hygiene practices or limited access to medical care. However, the truth is that this problem can also impact people in countries with high living standards. In fact, a scientific publication explicitly states that in the past decade, over 4.5 billion individuals have contracted different parasites. This implies that statistically, approximately 1 out of every 2 people have been or are currently infected with parasites. In light of the lack of attention given to parasitic infections, I would like to raise awareness today and shed light on the topic. I will discuss the symptoms that may suggest the presence of parasites, specifically worms and protozoa, as well as provide guidance on preventing parasitic infections. Additionally, I will briefly touch upon some natural methods for managing parasites. Let's start with the symptoms that can occur as a result of parasitic infection. During an intestinal parasite infection, the main symptom is digestive intestinal discomfort. This includes general discomfort in the abdominal cavity, such as abdominal pain and bloating. Nausea and vomiting may also occur. In the case of whipworm infection, diarrhea and mucus or blood may be present. If someone has giardiasis, the diarrhea is usually characterized by smelly and watery stools without blood or mucus. If chronic giardiasis develops, fatty diarrhea may also occur. Generally, the symptoms of giardiasis are similar to those of pancreatic and celiac diseases. In the case of ascariasis, constipation may also accompany diarrhea. When discussing the digestive system, it is important to note that infections such as pinworms, human roundworm, or tapeworm can cause a disruption in appetite. Specifically, there is a decrease in appetite, although in certain cases such as with tapeworm development, we may observe an increase in hunger. Parasites in the digestive tract feed on the nutrients we consume, which can cause uncontrolled weight loss in many individuals. If we experience sudden weight loss without any changes in our diet or diagnose diseases like an overreactive thyroid, it may indicate a parasitic infection. However, it is important to note that a significant weight loss would require a substantial infestation of parasites, such as over 60 worms in the case of human roundworm. Some species of intestinal parasites can damage the lining of the intestines, leading to chronic bleeding and loss of blood. Additionally, these parasites can decrease the levels of iron, vitamin B12, and folic acid in the body. This can result in the development of anemia due to iron deficiency in infected individuals. Symptoms of anemia may include pale skin, particularly around the lips and eyes, as well as dark circles under the eyes and a feeling of fatigue. Infected individuals may also experience excessive hair loss and increased fragility of both hair and fingernails. Interestingly, there is a specific type of anemia known as Meniere's anemia, which is caused by a duodenal hookworm infection acquired through contact with contaminated soil. This type of infection has been observed among minors. Parasitic diseases can affect more than just the digestive system. For instance, ascariasis, which is caused by a type of human worm, is one example. By understanding the life cycle of the parasite, we know that the larva it releases in the digestive tract can migrate to the respiratory system. Once they reach the throat, they can cause coughing and the expulsion of mucus. Afterward, they are swallowed again and mature in the small intestine. I guess few people would think that coughing is one of the symptoms of infection with certain parasites. In the case of ascariasis, the cough typically worsens at night and lasts for approximately 2 weeks, as this is the time when the larvae travel through the lungs. It is necessary to mention the pinworms, which are responsible for causing a disease in humans. This disease primarily affects children. The most notable symptom is itching in the area around the anus, particularly at night. This occurs because female pinworms lay eggs near the anus during nighttime, leading to the sensation of itching, and frequent scratching of the affected area can result in local skin inflammation and additional itching. It is worth noting that pinworms can also infest the female genitourinary tract, causing itching in those areas as well. Signs of parasite infection can also be indicated by changes in stool, such as the presence of tapeworm segments called proglottids. These segments are rectangular in shape and measure approximately half to 1 centimeter in length. Additionally, in the case of infection with an unsegmented tapeworm, these segments are capable of movement. Skin symptoms can appear in certain parasitic diseases. These symptoms are caused by infection with human worms. Specifically, there are reports of hives, conjunctivitis, and swelling in the face and limbs. Furthermore, infection with Trichinella species can cause swelling of the eyelids. Infection with human roundworms can lead to neurological disturbances. These disturbances can cause excessive nervousness similar to epilepsy. Signs of this excessive nervousness include frequent and aimless crying. Additionally, patients with human roundworm or whipworm infection may experience difficulty sleeping, insomnia, increased irritability, and nervousness. It is important to note that some of these neurological problems can be caused by parasites consuming essential nutrients such as minerals, vitamins, and especially B vitamins, which are necessary for the proper functioning of our nervous system. Furthermore, the invasion of parasites disrupts the balance of the gut microbiota. This microbiota produces various neurotransmitters, including serotonin and dopamine. Therefore, the parasite's inhibition of beneficial bacteria in the gut affects the nervous system. When discussing symptoms that indicate the presence of parasitic diseases, it is important to mention that some infections can cause a low-grade fever. This can occur as a result of infections with roundworms found in humans, dogs, or cats, which can lead to toxocariasis as well as tapeworms. Individuals who are infected with the parasitic worm from the Trichinella species, which causes trichinosis, may experience muscle pain. This pain can occur as a result of physical exertion or even without it. Typically, this pain subsides after a few weeks. It is important to note that certain parasites can cause additional health complications. For instance, in the case of giardiasis, it can lead to acute pancreatitis or cholangitis, which is known as hepatobiliary giardiasis. If we become infected with a tapeworm, cysts may develop in our liver. Lambliosis can also present with unusual symptoms. Along with cholangitis and inflammation of the gallbladder, reactive arthritis may occur, resulting in pain and swelling in one or more joints, typically in the lower extremities. Interestingly, lactose intolerance can also develop as a secondary effect of lambliosis. To protect ourselves from certain parasites, it is important to maintain good hygiene. This includes carefully washing all fruits and vegetables. Eating unwashed wild berries or other fruits from the forest can cause infections, especially with tapeworms, as they are carried by foxes. After playing in the sandbox or working in the garden, it is crucial to wash our hands, especially for children. It is also advisable to wear gloves while gardening. This is because dirt often contains parasites that can be transmitted from animals to humans, for example, dogs and cats being the main culprits. To further reduce the risk of transmitting parasites from animals to people, it is important to keep pets dewormed. Earlier, I mentioned the presence of a parasite called hookworm. Infection with this parasite can occur when there is a contact with soil that has been contaminated with human feces. Therefore, a preventive measure would be to refrain from using human feces as fertilizer, although unfortunately this practice is still sometimes done. Other parasites, such as the Trichinella roundworms mentioned earlier, enter our body through the consumption of raw meat that is infected. In the case of this parasite, it usually happens when consuming pork, horse, or game meat. Therefore, an important part of prevention is to avoid eating meat that is uncooked, undercooked, or insufficiently grilled. However, if we choose to consume raw meat, it is crucial to ensure that it comes from a reliable source. When discussing raw meat, I would like to provide an additional practical tip. It is common for us to cut raw meat on a cutting board and then transfer it to a pot. However, it is important to be cautious because if we then use the same cutting board to cut vegetables for a salad, we may unintentionally contaminate the vegetables with parasites. To prevent this, I strongly recommend regularly washing all kitchen utensils, including the cutting board, after they come into contact with raw meat. Furthermore, it is also crucial to maintain personal hygiene. This includes regularly trimming nails, changing bedding and underwear frequently, avoiding the use of shared towels, and keeping the kitchen and bathroom clean. Of course, we must also remember to take precautions when traveling to other countries, especially tropical countries or countries with low hygiene levels. For tropical countries, this means using repellents, wearing appropriate clothing, such as long-sleeved and long pants, wearing a head covering and sleeping under mosquito nets. In countries with low hygiene levels, it is advisable to avoid drinking tap water and not buying food from street vendors. In this episode, I will not provide detailed information on how to deal with parasites. I will cover that topic in another episode. However, I will briefly mention some natural methods. Personally, I believe in the use of various herbs. It is important to note that although certain herbs have been used for decades in a specific manner, it does not guarantee their effectiveness against intestinal parasites. One such herb that is recommended for parasitic diseases is wormwood. It is worth knowing that when consumed as an infusion or decoction, wormwood has low effectiveness in eliminating intestinal parasites. This is because the antiparasitic compounds present in it are partially absorbed in the digestive system before reaching the intestines. As a result, they do not reach a sufficient concentration to effectively eliminate the intruders. According to books on herbalism, one effective method for treating pinworms is to use an enema with wormwood extract. Additionally, applying wormwood extract externally to the skin can help eliminate skin parasites like scabies and lice. The same applies to common tansy, which can also be used as an enema or applied externally to the skin. Dr. Ożarowski, a respected Polish phytotherapist, suggests that tansy can be taken orally to combat human worms and pinworms only when other antiparasitic treatments are not available. Thyme oil is another antiparasitic ingredient. It is used for treating lice and pinworms similar to wormwood and tansy. However, herbalists themselves acknowledge that the oral use of thyme oil or thymol as a verminicide is no longer practiced. This is because it has been found to be ineffective and can even cause irritation and inflammation of the stomach lining. Similarly, preparations based on garlic, such as garlic decoction or garlic oil, have also been proved ineffective for treating parasitic infections when taken orally. However, using a garlic decoction as an enema can be beneficial in treating pinworms. We also have fresh pumpkin seeds without the seed hull. Phytotherapists say that these seeds do have some antiparasitic activity against human roundworm, hookworm, or pinworms. However, they emphasize that they may not be highly effective. This is because the varieties of pumpkin have varying amounts of cucurbitacins, which are antiparasitic compounds found in these seeds. I would also like to mention that cucumber seeds and watermelon seeds have the same antiparasitic activity as pumpkin seeds. I wanted to show you that the remedies or herbs suggested on various websites are not always helpful in practice. Plant raw materials and garlic, for example, are effective for many ailments, but they are not very effective against parasitic infections. The presence of antiparasitic compounds in these products alone is not enough to guarantee their effectiveness. To fight parasites, the dosage of the active substance in the target area, such as the intestines in this case, is crucial. Usually, when these preparations are taken orally, the dosage is too low to have the desired clinical effect. Therefore, prevention and good practices to prevent parasitic infections are the most important factors. If you want me to provide more detailed information on methods for dealing with parasites, including how to prepare specific herbs, please leave a comment. Also, I recommend watching another video on my channel where I discuss garlic in more detail, which was mentioned multiple times in today's video. If you want to learn more about the health benefits of garlic, simply click on the thumbnail that appeared on the screen.